Can an MRI help determine the cause of chronic headaches? Have you ever wondered if an MRI can help figure out why you are experiencing chronic headaches? It is a common question, and the answer is quite interesting. An MRI, which stands for Magnetic Resonance Imaging, can indeed play a role in understanding chronic headaches, but it is not a straightforward solution. First, it is important to know that an MRI does not directly diagnose primary headache disorders like migraines, tension headaches, or cluster headaches. Instead, it is primarily used to rule out or identify other medical issues that could be causing or contributing to your headaches. The MRI provides detailed images of the brain and surrounding tissues without using radiation. This means it can detect structural problems such as brain tumors, lesions, or issues with blood vessels like aneurysms. These conditions can sometimes lead to headaches. Additionally, an MRI can reveal sinus problems or infections that might mimic headache symptoms. Identifying these issues can help guide appropriate treatment. However, many individuals with chronic headaches have normal MRI results. In fact, the chances of finding something significant on an MRI are often low unless there are other neurological symptoms or warning signs present. Doctors usually recommend an MRI when headaches are frequent, severe, or change in pattern, especially if accompanied by symptoms like weakness, vision changes, or seizures. In some cases, doctors may also suggest a specialized scan called a magnetic resonance angiogram. This type of scan focuses specifically on blood vessels and can help detect abnormalities that might trigger headaches. In practical terms, an MRI is most helpful in evaluating chronic headaches when a doctor's clinical history and physical examination suggest there may be secondary causes. This means conditions other than primary headache disorders. The MRI helps distinguish between primary headaches and those caused by structural or vascular issues, infections, or other brain problems. For patients who have typical migraine or tension headaches without concerning features, an MRI is often not necessary. So, while an MRI can help determine the cause of chronic headaches by identifying or ruling out serious underlying conditions, it is not a diagnostic tool for migraines or other primary headaches themselves. The decision to use MRI is guided by clinical evaluation and specific symptoms that warrant further investigation.